Hello, everybody. Welcome to this week's Internal Medicine Grand Rounds. Just a few quick reminders before we get started today. For those of us joining in remotely, please make sure that your mics are muted and that your full name is on your Zoom login so you can be easily identified. If you are logging in as a group, please email Department of Medicine Grand Rounds to receive credit for today's lecture. We will save time at the end of the lecture for Q&A, so feel free to type in any questions you have into the chat and we'll try to relay them to our speaker. And we will try to wrap up around 12:55 so everyone can get back to their clinical duties in a timely manner. And with that being said, I'll give up the floor to Dr. Levis to introduce our speaker for today.
All right. Hi, everyone. I have the pleasure of introducing our last Grand Rounds for the last Grand Round speaker for 2025. Today is a special Grand Rounds that has really been a culmination of a labor of love between the Department of Medicine as well as our Hospital Wellness Committee to bring a book club opportunity to our faculty and staff. Dr. Jessie Gold is a nationally recognized psychiatrist, writer, and speaker that specializes in mental health care for students, faculty, and healthcare professionals. She received her master's degree in anthropology from the University of Pennsylvania, her medical degree from Yale, and completed her adult psychiatry residency at Stanford. She's currently the chief wellness officer for the University of Tennessee System and an associate professor of psychiatry at the University of Tennessee Health Science Center. Her debut book, How Do You Feel? One Doctor's Search for Humanity in Medicine, is a national bestseller. Just over a year ago, I had the opportunity, along with Dr. Shannon, to see Dr. Gold speak at a national conference, the Women in Medicine Summit in Chicago. I briefly met her at the time and received a copy of her book and proceeded to read it. And in her writing, I had felt particularly seen and acknowledged as a provider and had some profound realizations about both my personal and professional life. And so because of that, we wanted to find a way to bring it to our faculty and students. I'm honored and excited that she's here to speak with us today about the courage to be human, the power of vulnerability, meaning, and connection in healthcare. Please give Dr. Gold a warm welcome.
Hello. I have my phone and it's not because of any reason besides the fact that that clock says sometime that was not ever the time. Just so you guys know. Thanks for having me. That was a very kind introduction. I always prefer when people talk about things that are real and not just a bunch of things that I write down as like my CV. So I appreciate that. And thank you guys for bringing me. That's the title slide in case you're wondering. So we all like people who give disclosures, right? So most of the time it's like, I don't get paid by pharma to talk. Totally true. Don't get paid by pharma to talk. But I've realized that like these disclosures are more helpful, which is I work for a state school. My opinion's my own, but also wellness is like a very intersectional topic. And I have the identities you see, and I also see healthcare workers as patients. So I have conversations that lead me to understand things in a different way as a result, but I'm speaking from what I know, not what someone else might know. I like stupid cartoons and humor. It doesn't mean that I think this topic is stupid. It means that I think that it's hard to digest otherwise, and like it kind of breaks it up a little. If that's not your vibe, I apologize ahead of time. You're in the wrong talk. Lastly, I have been told that like mentioning COVID, having conversations about COVID at all, sometimes can be triggering for folks. So just as like should that be the case, you can leave or break or whatever you need to. But I would say like the most common trigger of a wellness talk is that you guys already hate me. I'm hoping to change that. But I know that a lot of times I'm sort of like a human personification of a checkbox, and that's really frustrating to healthcare workers. So I just want to say, like, I know what I'm coming in with. Hopefully, I can like break that down a little, but I know that coming in. I'm not going to go into objectives, but we'll talk about all of this stuff. I also put this because I realized like when I moved to Tennessee that I didn't understand Tennessee geography, but I also realized that when I talk about my job or my job is introduced, it's very confusing. So I just wanted to like center you on what I'm actually doing these days, so you had an awareness should you want to ask me questions later. But we have 5 campuses of the University of Tennessee. I work for the system, which means like it's parallel to all those campuses, and none of those people report to me, but I kind of trial by community as much as possible. But if you think about it, it's like the whole entire state. I live in the green dot in Memphis, the flagships, the orange dot that you see in sports, and it's about 64,000 students. So if that helps you kind of understand what someone has decided I'm in charge of, that's what I'm doing these days. So like early in the pandemic, I started giving a lot of talks, and I was giving a lot of talks to people who did not want to be in talks, but also were just like dealing with a lot. And I was dealing with a lot. And I realized that making a slide that either said, "How are you?" and giving people a second to answer that question, or asking people how they're feeling and doing the same thing, forced me to do it, but also forced everybody else. And so I've been putting it as like my slide beginning since. It just also happens to be what I titled my book, but it is like sort of adjacently the reason. But I'll give you like, if I ask you this question right now, like just take a second and answer that in your head. Based on that, how many of you said this or this? Just like raise your hand. Like really raise your hand. Okay. It's usually about 2/3, so somebody's lying. But here's the deal. Neither of those things are feelings, right? We answer like they're feelings because we're really used to like having a conversation about feelings that's not really about them, right? Like, "Oh, how are you? I'm good. I'm great. Whatever." Like, I don't really want to answer that question. Move ahead, the end, right? My favorite acronym for fine is feelings I'm not expressing. There's another one where the F is a curse word. Your call if you like that one better. But for the purposes of this conversation, it makes more sense to be the other one. So, I think we say it, we're definitely mostly not fine, but it sort of like is a word that just keeps the conversation moving and not having to dive into it. I've thought some about like why I think that happens in healthcare in particular. And I'll just like give you my hypotheses. You can reject them, but we'll start there. I think that we're taught like without a doubt that others, the work, patients comes before us. I don't think that's wrong. I actually think that makes sense. But I think what we learn almost is that like to then pause and ask how it affected you or to give any sort of credence to that is almost selfish. I've heard from a lot of folks that are trainees where they've gotten like, "You have bad boundaries" as sort of feedback around like, "That affected me," or "That was hard to see," or "Can we talk about that?" And so I think in those settings, like, yes, we should be putting patients first. We do a job that serves others, but we have to be mindful of the fact that it can and does affect us too. Another thing that I've heard a lot from folks is like this idea that like you kind of look around and no one else does anything. So you're sort of like, guess we don't do anything, right? I hear this a lot from people about codes in particular. So you see a code, successful or not, a hard thing to see. It just is, even if we forget that it is. And then you like look around, no one says anything, and you go see another patient or you go to lunch, right? And you're just like, I guess we see people die and then we eat lunch, and that's what you do in medicine, right? That's weird. We should just say that. And I think that when you learn like that, then you kind of become numb to the fact that it is weird, and then you start teaching the next generation with the same stuff. I had an experience sort of like this. I put more writing stuff in this than usual because of the impetus for the conversation, but this is like one of the first pieces I ever wrote, which is about an experience in med school where, for lack of a better summary line, I was tricked into doing cardiac massage on a patient who was already dead as a teaching opportunity. I didn't realize that until way later, but was in a sort of situation where I was like realizing it. The attending was really excited that that was a teaching opportunity. The other med student was really jealous that I got to do it. And I was like, something's wrong like in this, and I'm not fitting correctly, but I don't really understand that. I wrote this whole piece about sort of how I felt. It was one of the first times that I'd ever like tried to put into words like how we teach and how that affects people and what that's like to go through training in a way that was like a little bit more out there. I had talked to our dean about it, and she had sort of said, "Oh, that's what that guy does." But when I wrote this piece, I sort of also felt like she got an extra way to have the conversation that she hadn't had in a while either. So she like emailed it to everyone and said, "You should talk about this with your groups." But like when I was reflecting on it, I think a lot of what I realized was like that person just thought that that was a good experience and like hadn't thought about it in a while. And the other med student did think it was cool. And I just needed someone to talk to me about all of that and the fact that it was okay that it didn't feel cool to me. And that and like sort of taught me like not to have feelings about that stuff either. So first time I'd ever seen like a heart in a person that was still beating, right? And then it wasn't. So I think we have to just be mindful about like where our different experiences lie and sort of what that models. So, the other thing I'd say is like, this isn't a career for people who aren't like overachieving perfectionists. It just is. And when we think about perfectionism, I think a lot of folks think that like emotion runs counter to it. Like if I say the right answer to that, all of a sudden I'm not gonna be able to do anything for the rest of the day. And like, I don't even know how I thought I was going to do anything today. So I'm done for the day because real feelings just totally throw everything off. And so we mostly are taught to like, not, and that seems fine, right? And then lastly, I think it's modeled for the most part in our leadership that like stoicism is what you should be. You see that. You don't see a lot of leaders who talk about their emotions and their experiences. Our field was founded on that. Like there are tons of books about the people who founded medicine or any sort of field in healthcare. They weren't like rolling in work-life balance and stories about their emotions, right? So we are founded on that, and that's what continues to get promoted and supported. And so you see that and say, well, like, I'd like to be a department chair one day. Guess I should stop feeling, right? And that's what's modeled. Pager's like just giving me PTSD. But it's okay. Anyways, so basically I feel like we're kind of taught that this is what we should do, which is like we have some feelings about the thing, but we're gonna like put them over there and they're gonna like stay over there and we'll just keep going. I don't know about you, but for me, for my patients, like that doesn't work. It'd be really nice if that worked, but eventually it doesn't. I think it's a bit more like a beach ball, right? So like you push it down and it like stays down for a while with like aggressive pushing, but like eventually it'll come back and whack you in the face more aggressively when you least expect it, right? And so it's like it'd be great if we could keep it there. It's not going to stay. So like it's not a way to be really approaching it because it's just not feasible to be doing that. But I do think that there's another reason that I've sort of come to through my own experiences, which is I actually think we don't know we're not okay. That seems weird. We went to training, we learned signs and symptoms. Of course we know when we're not okay. We don't, and I'll tell you why, and I will kind of work it through my experience and my story in hopes that like shows you kind of instead of just telling you. And also because like not because I think my story is special, because I think it's not, which is the point. So at the height of the pandemic, I was working at WashU in St. Louis. I was seeing healthcare workers and their dependents virtually, had never seen virtual patients like probably anyone who got stuck in that situation, which was hard in itself as like a pivot. I'm an extrovert, so that wasn't fun. I was also voluntold into being charge of outreach and wellness for the faculty and staff for the hospital system. I asked a question and then got put in charge of it. So I said like, hey, what are we doing for the well-being of the faculty and staff? And they said, I don't know, Jesse, what are we doing? And so I was like a year and a half out of residency, writing a plan for how to address faculty and staff well-being at the height of the pandemic. Super normal. But that led to me doing a lot of like outreach and talks in between, also doing patient care. So I was like swimming in that all the time. And also secondarily had a ton of guilt about like being a frontline worker who wasn't on the front lines, right? It's like a weird thing where you were in med school or residency and they would have made you come in anyway. But all of a sudden you're an outpatient psychiatrist and you can do your job behind a screen and they're like, stay there. Why would you not do that? And so that was kind of like a weird thing for me. And I don't like the feeling of guilt. So I do more. So I did more. In that context, got like in like doing more press around well-being media stuff for lots of reasons, but really also because I was out there talking about healthcare workers and college students and other folks really weren't. And so it lended itself to it. This reporter was talking to me about burnout and like what it was and all the stuff you would ask an expert. Then at the end of the conversation, she's like, "Hey, Jesse, what's this experience been like for you?" And like, I'm media trained enough to know that's like totally going on the record and that I'm should be careful with what I'm saying. But I don't know. I was in a mood. I answered the question like I felt like answering the question. And then like a week later, 2 weeks later, she texts and she's like, "Hey, Jesse, I just wanted you to know that the tone of the article changed." And like any good person who's in leadership and didn't mean to be in leadership, I was panicked that I said something that I didn't remember saying and was going to get in trouble for. But what actually happened was that the article came out and this was the lead paragraph. So, lead paragraph meaning like the thing that would be the clickbaity part of the article, the thing that they find most interesting, right? I very quickly, as you can tell from that, went from expert to patient. And I wasn't mad at myself actually, and I wasn't mad at the reporter either. She was just doing her job, and she's a really good reporter on all things healthcare and parenting and things like that. But I actually was like, why is this interesting? Right? Like, why is it interesting to someone at the New York Times that a psychiatrist who sees healthcare workers in the middle of a pandemic might be affected by their job? And what that made me think of was like, we're definitely not talking about this at all if people think that's weird or novel or doesn't make sense. And why aren't we talking about it? And like, how do we get to this place where like it's expected that our jobs don't affect us in some way that makes literally no sense? So I got to thinking about that some. And I actually think burnout itself like lends itself to being ignored. So most people that I see in clinic will say something to me like, "Don't worry, Dr. Gold, I haven't hurt anyone yet." It's a terrible thing to say, right? Like if you said to a patient, like, "Don't worry, I'm burnt out, but I didn't cut off your wrong leg." Like that's just like a terrible way of looking at things. But we base all things on work, right? Like, did somebody tell us our work was affected? If not, we're good. Did somebody tell us my grades are affected? If not, we're good. The rest of our life can look like a complete mess, but it's okay because we show up every day and that's what we're supposed to do. And there's some validity in that, but I think it's also how we like base all things, and that makes it easier to ignore because for most of us, we can do work like on autopilot until we can't. And for me, it's this fun thing of like having those experiences and at the same time telling everyone else they're burnt out. So it's this weird way of sort of disconnecting from that entirely. And it's actually because like burnout itself, while it affected 50% of us pre-pandemic, like, ooh, I'm coming from there now, Andrea. It's okay. It's just weird for me to hear my voice while I'm talking. So the definition of burnout, the sort of way we define burnout it makes sense to why we can ignore it. So burnout is a workplace associated condition, meaning it is not in the diagnostic manual, meaning it comes from the systems that we work in, meaning if the systems didn't exist, we would not be burnt out. Okay. But it's a cluster of three things. The first one is emotional exhaustion. Now, like, is there anybody in this room right this moment who would tell me that they are not emotionally exhausted? I would like give you a prize because you're lying. Okay. So that's terrible. We all do jobs that are just inherently emotionally exhausting. So we go like, okay, I think we're just supposed to feel like that. Right. So then we go to this. So it depends on who you ask. It's either cynicism or depersonalization. Cynicism being anger, which is a much more acceptable emotion in our field, let alone most workplaces. Depersonalization is here because it makes more of my point, which is when we were in training, we learned you see hard stuff and you don't feel anything. And we thought we were protecting ourselves. And we are to an extent, but it's like we do that all the time. So it's like we started to do it to protect ourselves, but then we just like are doing it in every encounter, in every situation, and no longer feel like as connected to what we're doing. That's what that is. A lot of us don't notice that because we think we did it to help ourselves until we don't, right? Like it's a sort of subtle change. You guys are busy. I forget that I'm speaking to medicine people and not psychiatrists. Just kidding. Bad joke. Is your pager going off though? Thank goodness. Just checking. I was like, I'm pretty sure I picked a field where That's a different situation. I'm happy to talk to you about how that's a terrible thing. Um, anyway, so the last one's a sense of reduced accomplishment, personal accomplishment. You're doing less, feel like you're doing less. Someone said you're doing less. That's the part where you go like, hey, Jesse, what's wrong with me? Because that has to do with work or the way someone perceives you, right? The other ones we blow off. When we get to that, we start to notice. I also put my favorite definition of burnout, and it's literally just here just because it makes sense, which is that it's a mismatch between what you think work is going to be and what work actually is, right? So most of us wrote essays like, I just want to help people. I don't think, well, most of us did not write essays like, I just want to document and talk to insurance companies all day. If you did, your job is exactly what you wanted. Congratulations. But that difference is where you get burnt out, right? Like, I think it's this, it's not this, it's this. This is terrible, right? So you kind of go from like ignoring the symptoms to being like, I'm pretty sure these symptoms are a side effect of being in healthcare. Everyone feels like this, right? I picked two examples of this that like just kind of dig that in hard, which is like this person who tweeted this during the pandemic when it was still called tweeting, which is being a therapist right now feels like handing out sunscreen to people who are on fire, right? So like if you feel ineffective, that's what reduced sense of personal accomplishment really is. Like you don't feel like you're helping. Also, I put this more recently because someone sent it to me, and I just have now decided it has to live in my slides. So I feel bad for this guy, but it's not his fault. So he posted basically like, with his home likely lost to fires overnight, my department chair came in at 2:30 and started seeing patients in our hospital. This is leadership. Now, you could tell me, hey, Jesse, he had nowhere else to go. True. And yet, you could also say, hey, Jesse, who was covering for him. Also true. And yet, right. Like I've had people tell me all of these things afterwards because they don't want to say it in front of people. But like, I get that. That's the problem, right? Like if it's the expectation that a leader's house burns down and they still come in, why would you not come in when you feel sad? Your house didn't burn down. That doesn't count. Right. So I put that here just to say, like, if working hard is that, none of us are ever going to be like totally happy in the workplace. There's one study about this that I haven't found another study on. If someone else would like to do it, you should. But it's in surgeons. Take that with a grain of salt. But I actually think if it was repeated, it would be the same. And basically asked a bunch of surgeons to do the Mayo Wellbeing Index just to measure well-being in healthcare and said, like, hey, how'd you think you did? And the folks who are in the bottom 30% relative to national norms, right? Just not just to their peers, like national norms, bottom 30%. 71% of those folks said that they were at average or above average, right? What does that mean? That means I'm not sleeping, but when I look over here, that person's not sleeping like they're having a worse time finding sleep than I am. So I'm doing a really good job. Or I cry sometimes, but so do they. So like I think we just all cry a little, right? But like just because we have a culture that normalizes like not sleeping, not eating, not going to the bathroom, being moderately burnt out and a little depressed does not mean that's actually good. But what it does mean is if you kind of go, I don't want to feel this, this feels bad, you then start to go, I don't deserve to be here. I don't think that I am like somehow everyone else seems to be dealing with this and I'm not, right? Like it becomes about you, not the system. And that's unfair, but that's what happens. I went some fun extra steps like any good psychiatrist. So my main symptom was that I would like fall asleep after work and like not be able to fight falling asleep, like so badly that I would like sit in front of the couch, like hold my eyes open and I'd still fall asleep. And, you know, like any good psychiatrist was determined that it was a physical illness. Also because there's a differential diagnosis for fatigue, right? So that's super fun. I was like, someone will fix this. So I made my poor primary care doctor order labs at the height of the pandemic where you like had to do it in the parking garage. Not nice of me. But she was like, I don't think it's an emergency, Jesse. And I was like, it is, right? So she did my blood work and like I had low B12. Now, patients like a B12 shot and they always talk about it like it's the savior for all things fatigue. So I was actually really pumped to have a low B12 because I was like, I just need shots. If someone gives me shots, I'll feel great, like the kind of shots that go in your arm and not the other kind. But I did that, got those, didn't help. That was a bummer. Then I did what every single person I've ever seen in the history of the world does, which is like, don't worry, Jesse. In like 4 months, 3 days, a half an hour, you have vacation. And if you could just make it 4 months, 3 days, and a half an hour, like you're awesome, right? Like in January, I said to my personal therapist, I just need to get to May. And she said, Jesse, it's January. And I had zero concept that was a weird thing to say. I was like, well, that's how you measure time. It's like school year, whatever, right? So I was very convinced that if I took time off, I'd be fine. Time off is like a Band-Aid. It helps, right? So burnout is caused by the systems that you work in. If you're not in front of the system, you will feel better. If you're depressed on a beach. It's your brain, right? It's different. So if you take time off, if you have a weekend, you might feel better. It actually might be diagnostic a little bit that it's burnout and related to work. But you'll go right back to the same system as the same person with the same system. So you'll be buoyed a little and go right back later, right? I would never tell you not to take vacations. I want to point that out. This study is just terrible. It's a recent study of like how much we don't even like get inbox coverage on vacation. And here's the shocking thing. If you get inbox coverage over vacation, you're less burnt out. Like, it's the fact that we have to do these studies just blows my mind. But if you take more vacation days a year, you're also less burnt out, right? Like, also makes sense. They're called benefits for a reason. We just don't use them. Companies have unlimited vacation days for a reason too. It tricks people. They don't take any of them. But we have like select ones. Take them. But I won't tell you not to do it, but I will say it's temporary, right? Like that's not the fix. The fix is not vacation. It'd be great if we took them because it's part of our job, but that's it. Then like I went the other like even more most humbling of steps, which is to say I still didn't call it burnout. I was not getting better. And I went to my personal therapist and was like, I don't get this. Like, I'm not depressed. It's not this stupid B12 thing. I went on vacation. Like, what is wrong with me? And she just goes like, hey, Jesse, you're a frontline worker who sees frontline workers in the middle of a pandemic. Like, what do you think it is? And I started laughing because that's my defense of all things. And I started laughing and she was like, why are you laughing? And I was like, you're going to say I'm burnt out. And I gave a lecture on burnout this morning, right? But that's like all of us, right? I don't tell you that to say like somehow that's special, but I tell you that to say like I know the definition of burnout backwards, forwards, upside down. Like I will be able to tell you it because I give all the talks on it. And I still couldn't go, hey, that's the thing that I'm experiencing because I'm in medical culture. Because I'm trained the same way, because I look next to me and everyone else looks the same, because all my patients look the same, right? Who are also my colleagues, right? And so it is very hard to notice. And I am just giving you the validation to say that if I can't notice it, you probably don't either. And that's why it's something we need to be talking about and checking in on each other about and being able to acknowledge, because it is very insidious. Like it just is. So even despite all that, right? Like I can be like, yay, here's some really uplifting statistics. 50% of us are burnt out. Like 28% of medical trainees have depression. Really great statistics. Despite those statistics, we're just really bad at getting help when we need it. In part, same reasons I say, like we don't notice, but there's other things there. When they looked at this study from the pandemic, you can tell me it's not a study because you're a researcher in this room and it's a polling study from Kaiser and you're welcome. But it's the best study that there exists on this. But basically, if they look at how many people like actually got mental health care in the middle of the pandemic, it was like 13%. And then 20% said, I probably should have, right? So they asked those folks, why not? And when they looked at that, it fits into sort of two categories. One is systems, too busy, can't afford it, can't get time off. Valid, 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 right? Our system is broken. All of that makes sense. The problem with systems change is it takes a very long time. And most of you in this room are not in the position to be doing system change. You're in the position to give feedback about it, but you're not in the position to like actually physically make it so people get time off work to go to an appointment. It'd be great if you were. It's just not how that works, right? And so if you're going, I wish I got time off, I wish I got, like that is just going to make things worse because you have zero control over that. What you do have control over is this afraid or embarrassed to seek care bit, right? 17% of us are like, no, I don't want to do that. It's not right. It's not how we do it in medicine. It's not what we should be doing. That part we can actually all change with like how we talk to ourselves and how we talk to others. Simple. I'm not harping on culture because it's the only thing that needs to happen, but I'm harping on it because it's something we all can actively work on, and actively working on stuff feels a lot better than just being angry at a system that's not changing. And as people like me try to change systems, it takes time, and I'd like you not to quit in the interim, right? So you have to know some of this stuff. What's wrong with medical culture? Let's hope that this video works.
Sir, could I talk to you for a second? Oh, sure, Bill. What's going on? Well, my cousin's getting married next September. I was hoping to take the day off to go to the wedding. Cutting it a little close. That's only a year away. Yeah, I guess. Have you completed your paid time off proposal? Yeah, here it is. I got it notarized like you asked. I've included 3 references and a detailed itinerary. I'm sorry, Bill. We just can't risk it. What? I found backup to cover me while I'm gone. But not backup to the backup. Bill, you know we have to have 5 lines of backup before we can let a resident take a day off over a year away. Well, can the attendings cover? I need you to think long and hard about what you just suggested. What? You expect an attending to practice medicine without the help of a trainee half their age with a fraction of their experience? Hey, admin. Oh, surgery. What can I do for you? I'm going on vacation. Oh, okay. When will you be back? I don't know. See ya. Well, have a great time.
So all his videos are like system digs for like really reasonable things. So I was talking about time off, right? It's a whole mess. Like we don't have a lot of redundancy. That's the culture. Again, if you need all his lines of backup, good luck. Like again, if that's like our bar, like I'm actively vomiting and I'm going to carry an IV while I go patient to patient and I ask you where you work and you tell me in the immunocompromised unit, and that's how we do things. You're not taking time off when you're sad. Like it's not happening. Okay. People also won't understand because it's not happening. Right. I put this too because dark humor is based in truth. And I asked this person who posted this, was like this real? And he said, I don't know, it was in the bathrooms. Like, and so like during COVID, somebody thought that was funny, right? There's truth in that, which is why that's funny. Like someone put it in the bathroom, like go cry over there and talk to me later, right? I think that makes sense, unfortunately, in sort of this, we're fine. Just like you can't do that. You have to go do a lot. There's also this thing, I talked a bit about perfectionism in our culture. This is a piece that was in the BMJ around when Simone Biles stepped down from competing. It's a really good piece. I'm not going to harp on it, but really what I will say that it says that's important is like we're people who care a lot about people, but we also are really competitive. And so when there are winners and losers, when someone can get a residency and you can't, when someone can get a promotion and you can't, you are not going to like vulnerability because that other person doesn't have it. So it feels like something that you're going to lose because of. So you learn that vulnerability is not courageous, but instead a failure. You also learn that like somehow magically you won't make mistakes. Like, so when you make one, it's like that much of a harder thing because you were told like, oh my gosh, how could you make mistakes? You're not really a person who would ever make mistakes, but we're all human. We will make mistakes. So you look at the literature, burnout much higher in folks who have made an error, right? Higher suicidality in folks who've made an error, higher depression rates in folks who've had an error, because that's how we talk about stuff. Like, how dare you, right? Is this thing called self-valuation, which is like when you make a mistake, is it something you can learn from or something that's your fault? When they look at doctors, like 50% of us are more likely to say, like, no, that's my fault. And we have higher rates of burnout than other fields. And when they kind of control for this, it goes away. It doesn't mean that the only reason we're more burnt out than other fields is because of how we process mistakes. But again, if you take one thing from this, it's like, what can we control? We can control how we talk about mistakes. We can control how we try to learn from them. We can control like when we have M&M, actually asking someone what that felt like instead of just tell me the steps to not do that again, right? We don't do that. It's not our culture. There's also this thing, real fun thing called stigma, right? Which exists in medicine. We see it in how we treat our patients who have mental health things, but we also see it in how we treat each other. You might say, but Jesse, Gen Z, Gen Alpha, so much more evolved. That's not what's happening. But unfortunately, there's this thing called the hidden curriculum, which I think also has to do with emotions in medicine. And we teach everybody stuff. So you come in and they say, is it a sign of personal weakness to get treatment for emotional and mental health problems? And most of you say no, right? Like 10% maybe, or a little even under, are saying like it's a sign of personal weakness, which means inherently you don't believe that. But then they start asking questions like, well, what do residency directors think? And what do your colleagues think? And what do your other like patients think? And all that stuff, right? And then you start to see the numbers go way up, right? Like, but patients would judge me, but colleagues would judge me, but my supervisor would judge me, but residency applications would judge me, right? All that noise. And as a result of that noise, when they said, well, if you got treatment, would you hide it? Big numbers. Those are the same people who said it's not a problem, is not a weakness, right? But all of a sudden, because the rest of the world cares, and the people who are judging you care, and the people giving you grades care, or taking you into a job care, we don't talk about it. So it's a self-perpetuating cycle because there are definitely people getting help. I have a full clinic. But if they're going out and not talking about it, then we're just like, oh, nobody does that, so they're going to judge me for it. Oh, nobody does that, so they're going to judge me for it, right? So what can we do? So I call it staying human in a broken culture. Because again, there are so many systems in medicine that are interacting to create the way that our workplace is, and they are all really broken and they all need fixing. And in no way, in talking about ways to help yourself or help others, am I saying they don't need fixing. So how do we stay the way we are in the way that it is right now? If I could wave a magic wand, it would be different. That'll take some time. People just put me in charge, so like I can't do it that quickly. But I also want to acknowledge, someone asked me this in the book club today too, like, isn't it fixable by pizza? And I know they were kidding. But that's the thing, like, besides you guys kind of thinking that people who give wellness talks are just giving them to be a checkbox, we also are the people who do this, which is totally stupid, which is that like we somehow think that like you're going to feel better about a terrible workplace because I gave you a pizza party. Or the thing in the middle, it's just like terrible. It's an empty plastic bag and it says, I know this bag looks empty, but it's actually filled with our love and support. Happy Nurses Week. Again, people send me this stuff. It's great. If you see it, feel free. It's awesome. But that's terrible, right? We also really like to give people rocks. I don't know why, but if I was really burnt out and you gave me a rock, I don't think I'd paint it. I would do something else with it. And that's a dumb idea. But nonetheless, like this is what like wellness is, right? And I don't believe that. So the reason I started with the how are you feeling, whatever, is because the dumbest, most simplest thing that I've ever learned to do in my life is actually ask myself that question. I had never done it at all. I asked a lot of other people, but I had never asked myself. And why? Because that's not what we do. And so it is important to do that because if you think about this as like a scale, a spectrum, stress first stage like this is how we look at stress responses in the military. What a surprise or compared to the military again. If you're showing up in my office, if you're waiting until work is affected, you're in the red, right? What can you do for yourself in the red? Take time off, go to a psychiatrist. That's about what you got, right? If you're in the yellow or the orange, there are a lot more options for you. You didn't notice you were in the yellow or the orange because you were going to work and you're getting good feedback. In fact, when you overwork like me, people are like, oh my gosh, Jessie's so good at her job. Like, keep doing it. Look how good you are. You finish everything. Like, when you work harder and you do more to make up for the fact that you don't want to deal with things, people usually give you praise, and it's also a self-fulfilling prophecy. But you don't notice until you're falling asleep every day after work, right? Yellow for me is like patient inbox, speaking in patient inbox, or emails make me pissed. Not just like, oh, this is unfortunate that they wrote me this email, but like, how dare this person write me this email? I'm going to throw my phone and break it into pieces and enjoy watching it break, right? Like, a lot of emotion about that. I've been told that's not how you're supposed to feel when you read an email. So I realized, like, when I tried to like ask, like, spend more time trying to understand myself, I was like, why am I so mad? Well, if you're like a little burnt out, an email, a patient inbox, like, that's a task. Even if the task is to say, hey, make an appointment, right? Like, it's a response is a task. So more tasks, no capacity. Your response is to be like, how dare you? Leave me alone. You don't even know, right? Like, you're just pushing it out, right? And in doing that, like, to me now, if I'm very mad at my inbox, I want to take a break. But also it tells me like, hey, I'm not doing okay. I need to figure that out. But that's way before I'm in the red. It doesn't mean that I'm not still going to have patience, because there's a thing called biology and genetics and things where you will still show up in my office. I'm not trying to like not have patience, but I'm also, and like trying to discount mental illness, right? But I'm also trying to say a lot of us could do a lot more, paying more attention to subtle changes in ourselves that would prevent us from having to get to the point where we're here. And most of us are here because that's the culture we're in. When you kind of think about like, okay, well, what can I do then? Thanks, Jessie. I now know I'm not okay. I tell you this, and I put this graph here because I like to remind people that I'm not just telling you to take care of you for you. Like, I wish that mattered. But again, we're in this field where like we prioritize all things in the lens of like, but I'm here, I'm showing up. It's important to patients. It's not. I mean, like, the data on burnout and like showing up at work is like, you shouldn't be like, patient care goes like patient care, people stay in the hospital longer recovery times, less satisfaction, more errors. All this stuff should make sense, but we're like, but I'm here and that matters. And sometimes it doesn't. Sometimes it's worse, right? When you think about what you can do, people in my field have long done us a disservice by making it seem like there's only one skill you can do, and that's the one that's offered for free by your hospital. If you hate that, don't do that. I've had patients come to me and say they're bad at coping. That's not a thing. But that means you tried mindfulness 7 times and hated it. And that's okay. I hate it too. But there's evidence that it works. So if it works for you, that helps, right? But you should think about like coping and things to do in those moments as more like hobbies. And the one that you'll do is the one that you should do, right? Doesn't matter if your friend likes one. Doesn't matter that my best friend like does triathlons. I'm not doing that. Seemed like a good idea. I'm fine with like 20 minutes, right? That's a very different vibe, but some of us need different things. When you're thinking about what to consider, a big one in this that the literature will drive home and home and home again is this idea of like meaning and purpose. It sounds super woo-woo, but really, like, remember I said burnout's like what you think work's going to be and what work actually is? What we thought it was going to be was what we get meaning from. Most often patient care, teaching, things like that, where you're like seeing people's minds change and things. When we look at the things we're doing in our day, we don't spend a lot of time on the things that mean something to us. When you're a resident, you might have less control over this. But what you can know as a resident is like, when I'm with these kinds of patients, I feel like my energy goes up. When I am with these, it goes down. When I'm inpatient, I feel like this. When I'm outpatient, like, maybe that'll help you find the workplace that fits for you in the future. Whereas if you're in a place where you're ready in the workplace, you should go hour by your day and say, where am I getting energy? Where am I losing energy? What's that about? And try to make a difference in what that is. So what does that mean? Maybe you don't need 2 meetings that take all of your energy back to back to back. Maybe you go 5 minutes late to one all the time because you need a break for yourself. Maybe you move one because you're in charge. Maybe you cancel one because some meetings could be an email, right? All of these things are true. Maybe when you say yes or no to things, you think about, does this thing give me energy and meaning or does it not? And not just, is this good for my CV? Did somebody ask me to do it? Like some of that stuff you're still going to have to do. But there'll be things that you're doing because you think you're supposed to do it that really it doesn't matter. And they just ask you because you keep saying yes to things. So you can say no, but you also shouldn't say no to everything. So when you're burnt out, you're much more likely to be like, who wants to be mentored by me? I'm a terrible person right now. And you just like start saying no to all the things that actually would give you meaning. So being aware that like our gut reaction is to blanketly say no or just say yes to a bunch of things that we actually don't get meaning from and trying to negotiate that. Within that context too, there's this thing called 3 good things. It's basically like they have this study where they text people for 15 days and they say, what was good about your day? What was your role in it? How'd you feel? That's it. 15 days, text message back. After 15 days, people had improvement in emotional exhaustion, so burnout, depression, and happiness up to 12 months for 15 days of a text back. Beyond telling me that like you don't like the thing that the hospital offers, people also tell me they have no time to take care of themselves. Texting. How many times do you text today already? Like you can do this with the program, which is here. You can do it with friends. You could do it with your family. It's not that complicated. And then you might say, but hey, Jesse, isn't that toxic positivity? And it's actually not, because you're good enough at remembering the bad stuff. Evolution told you to remember that you ate a poison berry, not that before you ate the poison berry, you were having a really good time with your friends. So you don't need help. You got that. And you're a perfectionist. So all you're doing is having like a balance. You're saying that stuff happened. I'm not going to not know that, but I have to force myself to know the other stuff. That's okay. Just kind of makes it a little more balanced. And then I'll say, like, beyond sort of meaning and purpose, the thing that, like, across the board is the answer is social support. Like, being in a workplace that is supportive, that, like, values what you do, knows what you do, cares about what you do. I always say we didn't sign up not to work hard. We just signed up, like, hoping people would care that we did. Right? Like that's different. I didn't become a doctor thinking I wasn't going to have long hours. Duh, I'm a doctor. But I expected somebody to maybe sometimes acknowledge that. Right? And we don't have that a lot. And that's where that's coming from. So being aware as a leader that matters, being aware as someone else that you might want to look for a workplace like that, but also knowing that support can be colleagues. So what I'll say within that context is that when you look at like that article and why it was like so interesting to folks is because I did this thing called vulnerability that most people in medicine like want to throw up if you even say the word, but partially because the definition of vulnerability is terrible. Like uncertainty, risk, and emotional exposure are like 3 of the worst words you could put in a sentence and be like, do it. But I'm going to tell you to do that because if I disclose, you're more likely to disclose. That's what self-disclosure reciprocity is, because a leader who's vulnerable is courageous and empathetic, and that matters because you can't be creative and innovative without being open to failure, which means you're vulnerable, right? All those things are things that we say we care about, but do we, right? And when I say vulnerability, I do not mean that every single person in this room needs to be like, hi, I'm Jesse. I was burnt out. I've been depressed. I have a therapist. I probably said therapist 7 times, right? That's a lot. We need some people to do that. I'm doing that. That's what I signed up for. But we need most of us to be like, when we see one of those codes and then we're going to lunch, we might still have to go to lunch. But if you said to the med student, hey, it's real weird we're going to lunch right now, they'd go, oh, these people aren't terrible. Like they still have a soul, right? That matters. Maybe you're having a bad day because you didn't sleep because your kid was up all night. Maybe you should say that instead of just being mean to people, right? I'm having a bad day. I didn't sleep really well. I might be crankier. I'm sorry. You're a human. You have a family. It interferes with your work. All those things are vulnerability, right? So I'll leave you with this, which is to say that in my mind, I don't actually think any of us are okay and fine. I think we're like mostly not. And that's also okay and fine. But I think that we should be talking about it more. And I think that our field and our career is a lot more like this quote than anything else I've ever read, which is the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. Our field is like as rainy as it can possibly be, right? And that's okay. We signed up for that. We should talk about that, but we signed up for that. But when you acknowledge that, what happens is you can prepare for it to affect you. you can do things when it does, and you can not judge yourself when you do, right? If I go into a field going, my field is full of loss and suffering if I'm affected by this job, duh. Then if I'm affected by the job, duh, it's not my fault, right? And I think that that subtle mind shift, that subtle change in culture to like the expectation that our work affects us is basically how we change all of this outside of blowing up the system and starting over. And so it's a good place to start if I had a choice. So when someone asks you how you're doing, how you're feeling, maybe just one person you'll tell the truth to in your workplace. And maybe you'll still say okay and fine and be like, I heard a whole talk about how I shouldn't do that. And you're welcome, because I'll be in your head for a little bit. But other than that, I hope that we learn to be just a little bit more open with each other, and then we'll feel a little bit safer asking for help when we need it. Thanks for letting me come hang out with you. I think I have time, but I don't really. For questions. That's what happens. I'm a psychiatrist. Thanks.
So we'll just meet up.
Just kidding.
Yeah, there's a class coming in, so if you all have questions, we'll just be up.
The class hates me. I put my email because you actually can write me. You can also DM me on any social, and it's just me. So that's also fine. I don't have like a social media manager. That's stupid.